GOP House members. And we went over two items. The one that I think most of you are here for is the Medicaid expansion proposal that the Gang of Six came up with and made available on September 29th to the public and to our respective caucuses in the House and Senate. And we went through an incubation period of the 29th. The proposal became public on October 6th. We had a public hearing where stakeholders had the opportunity to speak, share their opinions, and ask questions and concerns, and particularly have healthcare providers on record in terms of their support or their opposition. And then continued emails, town hall meetings, and having colleagues really, again, continue to drill down on this issue and how we would move forward. All that culminated into our caucus meeting today, where we, again, there were many questions asked. There was a lot of technical issues addressed, and then maybe a reflection or a description of some of the feedback heard by stakeholders. And at that point, we called for a vote, and the proposal did not pass. It does not have the support of the House caucus. We're prepared to share with you how many did support it, because we think that that gives context. There are 75 members of the House. There are 63 Republicans, 12 Democrats. Of the 63-member GOP House, there were 7 members that supported the proposal to expand Medicaid. And so that's where we're at. That is the outcome of it. What's not been a quick process. We've been not just talking about this since this latest proposal came out, but we've been spending most of our bandwidth, frankly, on this issue since before the session began. Our first caucus meeting, all-day caucus meeting in December, we spent a good portion of that day on this issue. And I think it's fair to say, and I think I can share, that we had probably a dozen members that supported it then. We came back again together during the session after 2 long caucus meetings during the Tuesday and Thursday of the respective week of the session. We had about a dozen. We had a floor vote on Medicaid expansion, Healthy Utah. It received 10 Republican votes, 22 total votes, 52 votes against on the floor of the House. And then today, with the latest proposal, looking to address some of the issues of sustainability, whether the federal funds are sustainable, the enrollment growth and costs, and looking for a way to contain or to pay for those, addressing some of the concerns that we had heard over the months. That proposal was roundly rejected as well. With that, unless there's some additional details my leadership team would like to add, I'm open for questions.
Did you have the 7 votes? Was one of them you?
Yes.
And was one of them you, Jim?
Yes, it was.
And was one of them you?
Nope.
Okay. So leadership was split then?
Correct.
Just by way of a process, it was very important that people, this is a very tough vote. People will be happy, people will be frustrated regardless of how you cast that vote. So it was important for all colleagues, no matter whether you're on a leadership team, any member of the House was needed to be prepared to defend their vote, explain their vote to constituents they represent. And so there was not really any kind of arm twisting. There wasn't any trying to get people somewhere where they weren't comfortable being. And this was going to be a gut check. That's what this issue is. It's a very difficult issue. I don't suspect that, as President Niederhauser pointed out, that it's going away. But again, these are important votes that people have to be prepared to explain. And so through that process, you're going to find that you're not going to find maybe some of the familiar coalitions that you might find during the normal process.
What now?
You know, I'll tell you, the glass half full is this. I do believe there's political will to provide care for the needy. I think that was never problematic in our deliberations and our discussions about Medicaid expansion. I think this had always boiled down, Bob, to trying to comply with the federal code, with waivers that are granted or not, rules that are set for federal Medicaid expansion that we as lawmakers thought there was a better process, a better way to make the program sustainable, but we were not able to get certain, I think, critical concessions. And then ultimately, how we brought that to the providers the providers' concern and protest added to the debate. And it was one that I think had its effect as well.
Among the gang of six, it was the House that really had to be appeased here. The Senate and the governor had their plan that they were happy with, but the House was not happy with it. So this was going to be the plan that was going to be something that the House might support. So how do you explain how it had even less support than the governor's plan?
Well, I'll tell you, the issues there were three issues that the caucus and that the House really had trouble with during the session. One is the sustainability of federal funds. Is a 90% reimbursement higher than our traditional Medicaid for permanently disabled and children? And at that high of a rate, can we depend on that long term? Because if that rate ever changes, it changes the costs substantially. So there was a worry about the sustainability of the federal funds.
That's always been there, though.
Correct. And so then these were the concerns that we would need to mitigate moving forward. But these were the three concerns during the session. Second one was enrollment growth. We're seeing data coming in from other states shows that enrollment growth is far greater than what actuarial numbers came back that states based their decisions on. And we needed a way to, if those numbers did grow, if they were double or triple what we were expecting, when you're budgeting to a formula, not to a number, how do you make up that difference if you get it wrong? And that was something we didn't have an answer for. And the third is just the general increase in costs of Medicaid or healthcare costs. And how do you control those, or how do you predict them where they're not? Again, we have 600,000 kids coming into our schools. We don't have a system where we automatically fund enrollment growth of our schools. However, the proposal for Medicaid expansion would always, even years of shortfall, fully fund Medicaid expansion. It's a very tough prospect here in the House. So those were the three concerns. As we came in, we truly believed all three of those could be addressed. If you could leverage $450 million and ask the healthcare providers, the hospitals, doctors, pharmacies, who would receive those funds to pay 7 cents on a new dollar. And that was a proposal to create a restricted account that would build those funds that would satisfy the state's portion. And when the care providers, who would be the ones that would receive those federal funds, did not like that risk being shifted to them. And that's admittedly what we were doing. We were saying they would be the ones providing that. They said it was untenable. It was a risk too great to take. I think that brings you pause as lawmakers to say, if that risk to those receiving those dollars is too great, what does that say for the budgets that we have to pass? And again, remember, ACA has a funding source, and they can deficit spend as a federal government. We do not have a funding source for this, and we have to balance our budgets. And so those are very hard. State government and federal government meshing into one program is a very difficult prospect. And this plan, we believe, answered those questions for the state and the risks that would face the state. But healthcare providers ultimately said those were risks that they were not willing to accept.
Would you support in the Republican caucus for a very small sales tax increase to pick up the state's 50 million share, or whatever that is?
There had not been discussions on a broad-based tax up until now. I think that what we were trying to do is there was the potential for a decision to be made in October. If this plan that we had taken months to get to is not, there's not support for that. I don't think that's a question, Bob, for October. I think that could be a question pursued down the road. But right now, we were looking for something that we could hopefully see accomplished here this month.
Speaker, what would you say to the people who have suggested that the way the plan was structured, especially the funding source, pretty much guaranteed its failure? You knew there would be a lot of opposition from these provider groups. They're pretty powerful. They have powerful lobbyists at their disposal. Poison pill is the description some have used. What would you say to those people?
Well, Lisa, there's an easier poison pill than this plan that we took months and months to put together. And that would be to say, if the coverage gap is 0 to 100%, let's fund that. We know that the federal government did not want to do it that way. And that's a very quick and simple poison pill. This was not a poison pill. And frankly, as those concerns that I just described, those three concerns were expressed during the session, we heard that these same healthcare providers dismiss these concerns and say that these were not strong enough reasons for the state not to enter into this agreement. It is a surprise that since May 29th, once the assessment and the amounts we're talking about were out there, that there was that kind of opposition. People in hindsight can always say, well, we knew this would fail. I did not know that. I thought if you thought that assessment was onerous and too high, we're talking about $800 a year for physicians, $67 a month. We're talking about 23 million for hospitals. Now, the catch was, it was going to grow as the program grew. And that was the risk that was ultimately rejected. But that risk is the same one the state would face. I did not think, given that there were many voices, in fact, on a sheet of supporters of Healthy Utah, 22 healthcare organizations said those were not unacceptable risks and not risks at all, that to bring an assessment plan that was broad enough that those assessments weren't onerous, I did not expect them to say that those risks were unacceptable.
But it's a big difference between the state as an entity accepting this risk going forward and a doctor.
I agree. I think $67 a month is far different than $80 million of general fund money when there's not $80 million to be found. If you have $80 million that you have to find to fund this program, and that's again, taking the dollar amount of today's dollar amounts, just like the $67 or the $800 a year. There's only two pots deep enough of general fund money. It's your health and human services budget, and it's your higher education budget. It's one of the two. There, you can't wipe out Department of Natural Resources to pay for this. You can't take general fund money from the smaller departments. You've got two deep pots, and I would argue that it is very different. You're right. And I would say the assessments spread that across 18 provider classes in a way that made it something that could be implemented. But again, we were in an incubation period here to hear back from healthcare providers that these were risks that were unacceptable. That brings pause. And it does bring, I frankly believe that some lawmakers that were comfortable with Healthy Utah during the session, hearing healthcare providers argue that the risks were too high and too dangerous, had to rethink those positions. And I think that's why you saw the vote you did today.
But there is a third option, and Bob alluded to it earlier, and that's raising taxes, or not even raising taxes, but restoring part of the sales tax.
Yeah, that was never part of the discussions of the Gang of Six. That was never part of our deliberations together.
Does it have to be now?
Like I said, I don't think the issue is necessarily going away. I think there can be continued discussions to the degree that we could make a decision in the month of October. It really centered around this plan that we've spent so much time on. I think we've heard, and I'll tell you, I think that good information drives good decisions. And I think that we have been exhaustive in our study, our approach, our scrutiny to this. We put a plan together, and we've heard from all stakeholders in this. No one's been shy about where they are and where they're at on this bill. And you take that, and every lawmaker felt that feedback from their constituents, from those they represent, from stakeholders, and you ultimately make a decision based on that feedback.
What's your level of frustration, given that it's been such a long process and you still don't have anything, for you?
Level of frustration, for me, candidly speaking, everyone loves expanding Medicaid till they have to pay for it. And I think that includes everyone. It's a big number. It's a costly endeavor. I do think that the glass half full is that we do have the political will to help the needy. I don't know that you can do it in the way the federal government would like you to fit into their prescribed plan, but I do believe that the state of Utah, its legislature, has the political will to provide health care for those that can't afford it and need it.
So you're talking about some kind of an alternative to Medicaid expansion, going back to a Utah Cares plan, or
well, to your previous question, are there going to be further discussions? I believe there will be further discussions on this topic.
Senator Stuart said he could see a plan that shifts that cost burden to hospitals. He says that they benefit the most in the uncompensated care arena, something like that.
Yeah, it was revealing in our healthcare task force meeting when they said they would like a set number. They'd like 25 million. They would not like an open-ended formula that if the reimbursement from the federal government went down, they would pay more, or that would be up to their, anyway, they opposed anything that wasn't capped. And back during the session, we made those specific requests of Secretary Burwell that we could cap a program, that we would know what the costs are, like we do with traditional Medicaid. We budget to numbers on traditional Medicaid, and And frankly, we have, I think our Health and Human Services Chair said there was $70 million of requests for traditional Medicaid funding that we did not prioritize. Those are dollars. There's no formula that automatically funds all of that. When we've gone to the hospitals and said, even that, take it on the open-ended formulaic approach. They've been opposed to that. Nobody's comfortable with the formula of ACA's Medicaid expansion construct. Nobody is.
Is the gang of six finished, or is the gang of six going to keep working?
Everyone's really quiet here. How come I'm doing all the talking?
For me, the irony of it is that, President Obama and the Affordable Care Act was meant to help the people who didn't have insurance. It deliberately created a gap, 0 to 100%, the most vulnerable population there. I think as we visit with our colleagues, we would look at something that would take care of them, or the medically frail. 101 to 138%, there are insurance subsidies out there for them. And so what we will do and what we'll discuss moving forward, my guess would be something along those lines, whether it be a Utah Cares or something else. I don't know what that may look like, but I would bet in the senses of my colleagues that that's a population they would look at. I don't know, Representative Dunn, if you agree with that, that's a population that would be discussed more.
And that would be a 70% match.
Under that plan, but this is the issue, is that we control the caps, you control enrollment, you control the cost. It's something that the state can budget for and understand.
Yeah, you need to have something predictable. It just has to look similar to everything else we do in state government in terms of how we budget and plan. I'm looking forward. There were criticisms about this plan by providers. It's important to note that much of that plan and areas of criticism were not the way that we put this together, but what concessions we asked for from Secretary Burwell and HHS that they denied. One of the concerns with the physicians as a care provider class was that we would assess across the board. We asked specifically just to assess those that would accept the Medicaid dollars. That was a big request by doctors. We on 2 occasions, we met personally asking for that waiver, and we were told no. We've been and these haven't been adversarial meetings or contentious. They've been productive. Our state Department of Health has been working closely with HHS, getting information, getting feedback, so we understand the climate we're operating in. And some of the critical requests we made, they did not feel that they could grant. And some of those frustrations you hear about our plan are reflected from a federal requirement that isn't what Utah, if left to its own devices and block granted the dollars, would have put together. And so, we have tried very hard to fit into what the federal government would like to see by way of Medicaid expansion, but do it in a way that we think is sustainable, a way that we'll be able to provide it long term. And that was the plan that we presented, but it was not well received, really, by providers or other stakeholders.
So what about do you think you'll find a solution in the 2016 session?
It depends on the question we're asking. If the question is, can we get the 450 million federal dollars? That's a very hard game to play, as you can see from what we're trying to do now and how we have not been successful. Trying to comply with the federal requirements has been very difficult. We believe the risks are very high, and we think we've heard back from healthcare providers that when we've shifted those risks, their risks they are unwilling to accept. If the question is there something we can do to provide care for those who need it? I absolutely believe we can work in that space, but there seems to be a pivot that you guys, not just you, but everyone seems to play. If we talk about how we're going to help the needy, and they say, are you going to use Medicaid expansion? And we say, we think we need the latitude to create a state program. They say, well, how are you going to leave $450 million on the table? So then we shift over to 450 million and we talk about how difficult that is actually to get. And they say, what, and let people die? So if we're going to talk about the federal funds, let's talk about how difficult that would be to draw down those federal funds and what it requires the state and its legislature to give up. If we want to talk about helping people or bringing them care, let's talk about that and let's find a way to get that done. But there just seems to be, every time you talk about providing care, someone points out the money you're not potentially receiving. If you talk about the money, they talk about the people you might not be able to help. So if we're talking about the same thing, Robert, we want to find a way to help those who don't have care.
I just talked to a 23-year-old who said she filed for bankruptcy because of medical bills. And she basically said she's completely feels hopeless at this point. Is it hopeless?
I don't believe it is. I think what would have been, what it was, is a worst case scenario for me is to sign up with a plan that could potentially threaten, if you're in a year shortfall and we have signed up for a federal entitlement program that fully funds Medicaid enrollment growth. And you're in a shortfall year where every year I've been here for 13 sessions, and every year we have more kids that enter kindergarten than graduate. We do not every single year have the ability to fund, unfortunately, our enrollment growth of our schools. We try sometimes just to hold our schools harmless and not see money cuts occur during shortfall. It is very hard for us to say that in those years where we have to make those tough decisions, we will fully fund the enrollment growth of Medicaid, thus deepening the shortfalls that we have in other areas of state government. That is a scenario that I don't think anyone really contemplates, but is one that is a pretty dire circumstance if we found ourselves in that. If we signed up for a program that promised, or people began to depend on healthcare that we found that we couldn't pay for, and that people wanted to say, look, it didn't work, the feds changed their formula, so we're going to take it away. That's taking away someone's healthcare is to me a situation I don't want to put Utahns through either. So we have to compare kind of the scenarios that we're trying to, what we're entering and what those scenarios or unintended consequences may be, and try to make a gut call and do it the best we can. To that 23-year-old, I would say, we're going to keep working on how we can provide care for those that are needy and those who can't afford it. It's interesting to note, this plan would have provided Medicaid expansion for 126,000 Utahns. According to our Department of Health numbers, the number of Utahns who currently right now do not have health care, of that 126,000, is 31,000. So you're actually providing health care through this new plan for people who have or already qualified for health care to get to the 31,000 who don't have it. We might be able to do better than that. And we might, because we're not dealing with a behemoth of a federal government and all its regulations, we might be able to find a way to get water at the end of the road and help those who truly need it without it being such a larger plan and having to comply with the ACA regulations to get to those 31,000 who need that coverage.
So you addressed already the people who need the insurance or who aren't insured right now, I guess. What about the average Utah taxpayer who's, I guess, at this point paid in somewhere in the neighborhood of about $1.5 billion in taxes on Obamacare and sees this money just kind of going away?
I pointed that out. We've all paid our taxes. I think that the federal government has absolutely within its toolbox the ability to fund this coverage gap. You fund right now to a 400% of federal poverty level, but you leave out 0 to 100%. Why not pull that back to 200% and fund those who most need it? We've paid our federal taxes, as you pointed out, to do that. The challenge has been, in addition to those taxes and those revenues that the ACA created or Obamacare created, they now want states to enter into an agreement that would cost more dollars from your state, and in a way that we can't contain those costs. And I really do believe that after September 29th, when the dollars and the amounts were made public, when we heard, because I have a hard time believing that the assessment amounts were deal killers. What I think was the deal killer was the open-ended nature of expansion. And that is what the providers, was a risk that providers were not willing to accept. And I think that that is a further risk to the state, just to get, Robert, the 93 cents on the new dollar of federal taxes we've already paid. That 7 cents and how we would have come up with that, or the 10 cents rather, the unintended consequences, I think, is that we've drilled down on this have been too great. But I do think that we've paid our federal taxes, and I think we have a Congress and an administration that ought to deal with how we can see the benefit of the taxes we've paid.
So is it more likely than not that we're going to move forward? Utah is going to find a way to help those in need without any of these federal dollars? Does it look more and more to you like we're not going to?
We've stared at so many different scenarios at this point, from the session up until now, on how to leverage those dollars. And as we've tried to find those solutions, we see resistance, all boiling down again to risk. I do think that the way forward is one that is a Utah way, a way that we can use what we believe would make the program efficient, what would make it successful, what will make it sustainable. We have to do that. If there's been an upside to this entire discussion, it is that we do have that political will to see that through. We just have to have the federal dollars make it much harder. It's harder when Washington D.C. creates rules for this legislature to work in, when every other area that's within our purview, we work on how we fund those priorities. And that you give up that control as a legislature when you sign up for federal programs, and to the degree they want us to sign on to what their rules are and what we have to let go of in terms of our ability to execute the program, we can't. We're not finding that. We're not finding the way to do it. We've asked by way of waivers, and we've been told no. We've tried to show those that we took the woodwork here. So that state takes 25 million. It's more than double any provider classes amount that they'd be assessed. We look for, if you're going to have $450 million come, pay 7 cents of a new dollar. It has been wholly rejected. What do you do? I mean, I really believe that we would see more interest in that.
One last political question from me. Next year is the governor's race. It's all you guys are up for election, half the Senate. Is it going to be more difficult politically to get this done in the 2016 session?
I don't know what would feel more difficult than this right now. I mean, I feel like we're all getting incredible feedback. I think that the election year, I know observers believe that brings increased scrutiny or pressure. The House caucus has been through a lot. We've been through a lot on this issue, and we've worked very, very hard. And I don't know that it could feel more pressure filled, and the odds or the stakes being higher than what we've lived through now and what we've worked on. So, I think we're starting to get numb, Bob, from it in terms of we know what the stakes are, and I don't know whether the year being an even or odd numbered year is going to make any difference at this point.
Could we talk a bit about process? You made a really important decision that affects a lot of people in this state today.
Okay.
But you made it behind closed doors. Public, the people that are directly affected by this, as well as the people being asked to pay for it, the general public, the media, none of us were able to hear the debate and hear the concerns. And I know you're trying to convey some of those now, but why do this behind closed doors? You open a lot of your caucuses. Why make such a crucial decision on behalf of the people of the state behind closed doors?
Our caucus, we have closed caucuses on a number of occasions. You have a House leadership team in front of you, in front of a bank of cameras. I think there were two bodies in the legislature, the House and the Senate, that met today. I don't think our process is different than those. I'm sure you've asked President Niederhauser why he insists on operating behind closed doors all the time. We, as you've pointed out, open most of ours. I'm sure I'll read what his comment was to that question. But the issue is this: we come into these caucus rooms, and we know that the votes we make and the opinions we express, we're going to have to come out and be able to defend those. And some of that candor, some of those conversations, we feel are more thorough, more genuine, and prepare us for the public positions we're going to take on this.
So how can you be called upon? I mean, as a constituent, I'm your constituents. Well, you said how you voted, I guess. But
I did.
Most of the people in here, the constituents, don't even know how their representatives vote. And so how can they be called on to defend those?
But these are political caucuses, Robert. They're the way you know how your elected officials vote are in the committee hearings and the floor votes that they engage in, as always. I mean,
Right.
that is always the case.
But there's no floor vote, there's no committee vote.
But whose fault is that? In other words, this is my point. People have tried to say there's a parliamentary trick going on when a caucus arrives at a 38 vote caucus position. The caucus position for the House Republicans has been 38 since I walked through the doors as an elected official in 2003. It's never changed. The idea that a bill will hear or be debated on the floor of the House in a special session is not decided by the Speaker of the House. That is a call that the governor puts together and puts on the floor. Now, good politics and process is that the governor is probably going to talk to the Senate leaders, the House leaders, both majority and minority, and make a decision whether they want to put a bill on the floor. if that occurs, you'll see votes on the floor. And people will know if a session's called, where their colleague or where their representatives stand. But that's the process that we have. That's the legislature.
There are a number of points there, but let me ask you to follow up on one of them.
Sure.
Again, you said that your colleagues, members of the House Republican caucus, are going to have to defend their votes on this particular issue, or defend their viewpoints on this particular issue. But I can't tell my readers, I can't tell their constituents what their viewpoints are on this particular issue because the votes are all secret.
Well, it's the difference is, I think you're confusing whether we open or close a caucus with whether our constituents know what our positions are on issues. And I can tell you with the volume of emails that are going on, the phone calls that are happening, the town hall meetings that we're having, I don't think there's any doubt where representatives and where senators and where this legislature, where we're going to be on any issue, whether it's this one or any other one. An issue with this much attention, I don't think you're able to, frankly, hide where you're at on this. I mean, I think that, again, if you're a good representative, you're going to be answering your emails, your phone calls. I held a town hall meeting, physicians only town hall meeting, by the way. Try one of those out. Those are fun to have. Trying to explain the program, the plan as thoroughly as I could. They know where I was at. There was no secret to that inside that meeting. There was, people know where their representatives are if they ask them.
How many caucus votes were there for the gas tax increase during the session?
You're asking me to recall during the session. I couldn't tell you.
Here's an easier
Was it-
question. Who else voted for this today in your caucus besides the two of you?
Well,
Will you
Ask
tell us
them.
the names?
no, we didn't. No, I don't have the names.
You know there are 7, so who are the other?
I'm one. There's two.
Right, who are the other 5?
You'd have to ask legislators and they'd have to tell you where they're at on the
So if the
bill.
public wants
I
to
don't
know
think they're going to
who
hide it though,
asking
Lisa.
for-
Ask them where they're at. I think they'll tell you where they are. This has been a very difficult issue. And I think every member is ready to defend their position on this. And I think you just need to ask the members where they're at.
Representative, you voted against, why?
I don't believe that it's a plan that we should expand Medicaid past 100%. As I alluded to before, President Obama and the creators, the architects of the Affordable Care Act in their infinite wisdom decided to not help the needy and the most needy. We have a traditional Medicaid plan that's underfunded. And those are truly diagnosed, disabled adults with real issues and real problems. Those are children that have no choice in their situation. And that program is continually underfunded. Providers are paid at 40 cents on the dollar for those. But yet we want to expand to a class that has coverage up and above 100% poverty. They have the ability to get coverage now. And so for me, why do I want to fund that when I can't even properly fund the children and the disabled that are truly needed the help when we have waiting lists for that population to get on? I mean, those are some of the reasons I voted no.
Okay, we done? Thank you.
What was the cake for?
The what? It's my birthday.
It's his birthday
It's my
today.
birthday.
Okay.
We're going to party like it's my birthday.
This is his birthday shoot.
How you like that?
You voted.
Correct. Yeah, I voted no also, Lisa.
We narrowed it down. You voted.
Senator Burton.
Thank you. 48 people.
Yeah, that's a great.
We didn't have a caucus. They didn't tell us what the poll. I mean, they did not give us numbers, and I said that in the story. But